Good afternoon, and welcome to our Facebook Live discussion. I'm Dr. Melissa Sutton, a Senior Health Advisor here at the Oregon Health Authority.
I'm Dr. Bill Messer, Assistant Professor of Molecular Microbiology and Immunology in the OHSU School of Medicine.
Our discussion topic today is COVID-19 variants. We know there's a lot of interest in this topic, and there's been a lot of media attention on variants around the world, across the United States, and here in Oregon. All viruses mutate or change over time, and mutations to SARS-CoV-2, the virus which causes COVID-19, have given rise to new, and in some cases, more transmissible forms of the virus, which are contributing to the recent increase in cases and hospitalizations we've experienced. Here in Oregon, we are monitoring virus variants closely, with active sequencing taking place in laboratories across the state. That sequencing helps us to better understand how the virus spreads. Dr. Messer will discuss the science behind variants, the active sequencing being done here in Oregon, and some of the discoveries. I will follow with an update on the pandemic in Oregon, and then we will answer your questions.
So many of us are already familiar with the idea of a variant from our experience with the influenza virus. And as you may have heard, at the beginning of every flu season, we review, and if necessary, modify the annual flu vaccine to better target the strains we expect that will be most widely circulating. The difference with the novel coronavirus is first in the name, novel. This virus that emerged in 2019 is completely new to humans, meaning we have yet to develop any natural immunity to it, and the virus itself is still adapting to us. Although we're now fortunate to have three highly effective vaccines available in the United States, each time the virus infects someone new, it has a chance to mutate. As these mutations, and each mutation raises the possibility for the virus to evolve in such a way that it becomes more transmissible or eludes the body's immune system, even among people who've been vaccinated or previously infected. This is why vaccinations are so important. It stops the virus from spreading and evolving. As Dr. Sutton noted, we're working to sequence or identify the genetic code of as many samples of the virus as possible to detect the spread of new variants. At OHSU, our SARS-CoV-2 Genome Sequencing Center has sequenced about 4,000 genomes to better understand how the virus may be entering, spreading, and changing across the state. For today's conversation, I'd like to offer some definitions about what we mean when we say variants. When referring to SARS-CoV-2 viral variants, a variant is any SARS-CoV-2 virus that is mutated to be genetically different from the original SARS-CoV-2 virus that first emerged from China in 2019. We often refer to that first virus as the parent or wild-type virus. We can only know whether a virus is a variant by obtaining in the laboratory the genetic sequence of the virus, or sequencing for short. We can then compare that virus sequence to the wild-type virus sequence and establish whether those sequences are different or not. As you can imagine, there are hundreds of variants out there, but most of them don't seem to cause much trouble for public health. However, some variants do appear to be connected with outbreaks or simply take over transmission in a given place. When these viruses are detected, they get classified in a couple of ways, which will be shown as a couple of slides in the chat. Variants of concern and variants of interest. The CDC defines a variant of concern as a variant for which there is evidence of increase in transmissibility, more severe disease, i.e. increased hospitalizations or deaths, significant reduction in neutralization by antibodies generated during previous infection or vaccination, or reduced effectiveness of treatments or vaccines, or diagnostic detection failures. So these variants of concern are variants for which we have evidence for those particular concerns. The CDC defines a variant of interest as a variant with specific genetic markers that have been associated with changes to receptor binding, reduced neutralization by antibodies generated against previous infection or vaccination, reduced efficacy of treatments, potential diagnostic impact, or predicted increase in transmissibility or disease severity. The difference being we don't have proof for these variants of interest, but they look a lot like they could become variants of concern.
Thank you, Dr. Messer. Before we dive into your questions, let me provide a brief summary of where things stand with the pandemic in Oregon. We're continuing to experience a surge in daily cases and COVID-19 hospitalizations that began about a month ago. Over the last 7 days, Oregon has averaged more than 700 new cases each day. However, both cases and hospitalizations showed small declines over the past week, a hopeful sign that things are improving. We expected this improvement as more and more Oregonians are getting vaccinated. Despite the good news, we remain concerned about variants, that they're spreading more easily and might make people sicker, especially younger people. We also worry that they could make vaccines and other treatments less effective. Since the pandemic began, more than 1,200 variants of concern and 93 variants of interest have been detected in Oregon. And over time, variants of concern are becoming more and more common. The B117 variant, also called the UK variant, has become the most common variant in Oregon. And we believe that more than half of all COVID-19 cases in Oregon are now caused by the B117 variant. Other variants, such as the B1351 variant, also known as the South Africa variant, and the P1 variant, also known as the Brazil variant, are also circulating in Oregon at low levels. The B117 variant is about 50 to 60% more transmissible, and it appears to cause more severe disease in younger patients. That means that even though we are all tired of fighting COVID, it's more important than ever to remain vigilant, to wear face coverings, to physically distance, and to avoid social gatherings. As more Oregonians get vaccinated, things will improve. There will be fewer cases of COVID-19, and we can all return to a more normal way of life. We are so close, and we thank you for doing your part. Oregon vaccinators are administering an average of 34,000 doses of COVID-19 vaccine every day. More than 1.5 million Oregonians have completed a COVID-19 vaccine series, and we are days away from surpassing the milestone of 2 million people who've received at least one dose. Vaccines are currently available to everyone 16 and older, and soon they'll be available to everyone 12 and older. Getting vaccinated is the most direct path to ending this pandemic once and for all in Oregon. So please make your plan to get vaccinated. You can register through Get Vaccinated Oregon's web tool at getvaccinated.oregon.gov. The CDC offers a vaccine finder tool at vaccinefinder.org, where you just type in your zip code to find vaccines near you. And Oregonians can always get help by calling 211. We're ready for your questions now, and we want to make sure we can get to as many of your questions as possible. So we'll only be taking questions on the topic of variants today.
It looks like our first question comes from Ginny, who asks, are the vaccinated causing the variants? Are they asymptomatic spreaders?
Ginny, that's a great question. The vaccinated are not causing variants. In fact, we're very much in a race of vaccines against variants. The more people get vaccinated, the less chances there are for new variants to emerge. So vaccination really is the cure for variants. There are asymptomatic spreaders of COVID-19, and this is what makes COVID-19 such a difficult disease to control. We think about 50% of people who are infected with COVID-19 have no symptoms, or maybe some symptoms so mild that they don't even notice them.
The next question is from Nick. What's the difference between variants of concern and variants of interest?
So thanks for that question, Nick. To summarize the definitions that we went over early, to distill it down to a simple principle, they're viruses for which we either have proof, which would make it a virus of or a variant of concern, that they do something that potentially makes the virus a greater public health concern. That can be proof of greater transmission, proof of causing more severe disease, or proof of escaping from vaccines or therapeutics. A variant of interest is a variant for which we have genetic information from the virus sequence that suggests it may act like a variant of concern, but for which we don't have any hard evidence yet that that variant actually can do that thing that we're worried about it doing. When it becomes a variant of interest, it becomes a virus that we track very closely to see if there is, in fact, in our observations of what's going on in a population, evidence that this variant should be a variant of concern, at which point we would reclassify it, but continue to track it.
The next question is from Jamie. If the vaccine works against the variants, why are we not seeing a decrease in cases?
Yeah, that's a good question, Jamie. So as I described over the last few months, the B117 variant, or the UK variant, has become the most common variant here in Oregon. And that variant, the thing that's really special about it is that it spreads a lot more easily, 50 to 60% more easily than the old-fashioned variants. That means that more people are going to be infected. What we've seen in other states is that when B117 becomes the most common variant, those states have experienced similar surges to what Oregon is experiencing. What we've also seen, and what's very hopeful, is that as vaccination rates have increased in those states, those surges have ended. So again, we really want people to get vaccinated in order to help end this surge and also reduce worrying about variants emerging over time.
Thank you. Go ahead.
Just an alternate way of thinking about that, if we hadn't been vaccinated or vaccinating and engaged in this vaccination campaign and B117 emerged in our population, we probably would have seen even more cases than we're seeing now, because the vaccines are still doing their work, but they're doing their work against a different virus that spreads more easily.
That's a really good point.
Our next question is from Dina. How many variants are circulating in Oregon? And do we know if the vaccine covers the variants?
How about I take the first part of that question, Dr. Messer, and you can have the second. So there are many variants circulating in Oregon. You know, as variants are created, there's really an infinite number that can be created by so many mutations. That said, despite the fact that there are many individual variants, the most common variant that we're seeing is that B117 variant, and that is well over 50% of the variants that we have here in Oregon. I don't have an exact count, but it's many, many, probably something like 100 or more.
As far as vaccine efficacy goes against the variants, while there has been a lot of talk in the media about changes in vaccine efficacy depending on the variant, the bottom line is the vaccines are all three of the vaccines approved in the US are all effective against the variants. They all provide substantial protection against the variants. None of these variants are, in the way that influenza variants are avoiding the vaccine. The vaccine is still providing robust protection against all of the variants.
Our next question is from Verity. How can you know the increase in cases is due to variants?
Yeah, that's a good question. You know, we think that it's true because we have seen a similar pattern occur in other states who have had similar proportions of the B117 variant. We also know from research and from studies that the B117 variant, which has become so common in Oregon, does infect more people. We can't say exactly how many cases are happening because of B117 and how many are happening because of other variants, but we do know that those things are linked.
Our next question is from Andrea. Does B117 spread more easily outdoors, or is it still transmitted mostly indoors?
That's another great question. And I actually hear that question a lot. So, you know, we have said since the early pandemic that being outdoors is a lot safer than being indoors. And that's because when we breathe, when we speak, when we sneeze, when we cough, we exhale little droplets, and those can contain virus. If we're indoors, those droplets can kind of float around and be inhaled by other people. Outdoors, the wind carries those things away. That's still the case for the B117 variant. So, you know, being outdoors is still really, really safe. That said, you do want to maintain 6 feet of physical distance to be safest. And if you're, you know, away from people you know, if you're out in public, wearing a face covering is safest.
Next question is from Jeannie. How is this COVID-19, how are these COVID-19 variants any different from the variants of the flu each year?
So that's a really interesting question and a complicated one to answer. But I think the simplest way to explain it is that influenza has its genetic code is stored in several separate pieces of RNA, which make up the genome of influenza, whereas the coronavirus just has one piece. So the influenza virus and the coronavirus pieces can individually mutate, and that's the mutations that are leading to the variants that we see in SARS coronavirus 2. In influenza, those little pieces of RNA that make up the genome of influenza can actually be reassorted between different viruses. So in addition to very small changes in one piece of genetic code or RNA, influenza can swap whole pieces back and forth between different viruses. And that swapping back and forth allows the makeup of the virus to change dramatically and more or less instantly as a new virus is formed by the recombination of these pieces of genetic information. And so influenza has the potential to evolve just like SARS coronavirus 2 does, sort of incrementally with small changes in one piece of genetic code. But influenza has the additional ability to swap big pieces, which coronaviruses can't do in the same way as influenza does. So in some ways, influenza is much more prone to mutation than coronaviruses are, which have fewer tools to mutate than influenza does.
Next question is from Dina. Are variants detected by a standard COVID-19 test?
They are. So one of the things we worry about when we talk about variants of concern and variants of interest is that they could develop mutations that give them the ability to not show up on standard tests. We haven't seen that happen yet in the United States. It is something that we're watching for, though.
Next question comes from Sky. Are you taking random samples of positive tests for sequencing, or are you limiting sequencing to breakthrough cases?
That's a good question. So there's a lot of sequencing going on at a lot of different academic centers, including OHSU, as well as at the Oregon State Public Health Laboratory. The criteria that each sequencing partner is using to choose who they sequence are different. So at Oregon State Public Health Laboratory, we have a list of high priority criteria that we use to say, yes, this can be sequenced here, or no, we don't have the capacity for it. It has to do with vaccine breakthrough cases, cases from outbreaks, and some other considerations. In some of our academic partners are trying to sequence everything they have. And I wonder if Dr. Messer would speak about what OHSU is doing.
Yeah, so that's actually a very important question. And at OHSU, we are sequencing everything that we have as long as we believe there is enough virus present in the sample for our sequencing methods to actually be able to give us a result. And the reason it's important when you have the capacity to look at everything is it's important to know what the overall landscape looks like. Is there a new variant that is emerging that we haven't detected previously because we hadn't been watching for it and is moving through the population? Or simply what proportion of the variants of interest and variants of concern are seen if we look at as broad a possible sample as possible? So where we have the capacity to do sequencing at that level, that's what we aim to do.
Next question is from Jill. If the vaccine doesn't stop the transmission of SARS-CoV-2 virus, it just reduces the symptoms of COVID-19, how are the people doing symptoms-wise with these new variants?
So I think there are two ways to think about answering this question. Dr. Sutton and I probably both have a thought. The first is that the vaccine certainly does in many cases stop transmission cold without any asymptomatic infection in the vaccine. It is also probably likely that there are some people who have a asymptomatic infection, because we know that there are also people who get the vaccine who occasionally do develop symptoms. In general, the symptoms are milder in the vaccinees, and the effect of the variants on symptoms in vaccinees probably not been studied well enough to actually know whether people are getting sicker or not if they have a breakthrough case with a variant. Dr. Sutton, you may have an additional perspective on that question.
Yeah, I agree with everything that Dr. Messer said. This is something that we really need to research right now, and there are a lot of people who are doing just that, including Oregon Health Authority. We're actually launching a special study to look at this question and some related questions this month in partnership with Kaiser Permanente and OHSU.
Thank you. Next question is from Tom. Wouldn't the OHA Variant Dashboard be more useful if variants were expressed as % of total sequenced samples at all Oregon sequencing labs, plus the variations of those percentages with time, say, per week or month?
So the OHA Variant Dashboard, it pulls its information from a public repository called GISAID. And we are asking everyone doing sequencing in Oregon to report their data to GISAID. So it's not a perfect process. It takes sometimes more than a week, sometimes 2 or 3 weeks even, to get that data sent over. Yeah. But the reason we've done that is because we want that information to be available to everyone and anyone studying variants in real time. So that dashboard actually does represent numbers for all of the sequencing being done in Oregon, or at least most of it.
Next question is from Geneva. How long will the vaccine be effective against variants?
So this is an extremely difficult question to answer. And the short answer is we don't know. The vaccine may be effective against the variants for the remainder of the pandemic. And in fact, that would be our hope, particularly if we can drive transmission down. If a vaccine fails to be effective against one of the variants, it is simply something that we would have to wait for to see and detect. At this point, it's really impossible to predict when or even if that will happen. But it's a very challenging question.
Okay. That was the last question we have. Do we have any other questions too? Okay, let's then that was our last question. And if you'd like to wrap it up, Dr. Sutton.
Sure, happy to. Thank you everyone for participating in our Facebook Live discussion today. Please go out and get vaccinated and have a great day.